Hi guys, Christina here. Today we are going to be talking about the symptoms of dissociative identity disorder. Well, like I mentioned before, dissociative identity disorder is a complex coping mechanism where the brain actually helps a person function normally and carry out their day to day tasks after repeated traumatic events. Probably that has occurred during their childhood. Basically, DID is like a more extreme version of PTSD, that is post traumatic stress disorder. There are three major dissociative disorders that have been identified. DID is one of them. Apart from DID, the others are dissociative amnesia and depersonalization and derealization. So, DID, which is the dissociative identity disorder, is has a lot of symptoms that include dissociative amnesia as well as depersonalization and derealization. In the case of DID, the there is a disconnection and a lack of continuity with your thoughts and your surroundings and your memories. This is done why a dissociation takes place is so that the host, in this case it would be me, Christina, would be prevented from remembering the traumatic memories that have happened. Symptoms of DID are a sense of losing time. Now, there are times when you lose track of time. Technically, everyone does, right? But then it's probably because you are doing something that you're enjoying and you just don't realize that a lot of time has passed. So that's what happens with us as well. But then for us, there are times where we sometimes lose a huge chunk of hours, days, or even weeks when our body is basically just on autopilot. And what happens is that the sense of losing time usually comes in when probably another alter presented and they are the one who's making you go through your daily routine. For example, I've had times where I've been reading a book or I've been watching a movie and I would have already finished it. But probably midway of me doing that particular activity, another alter would have switched in with me and I would just not know what happened at all. So that has happened quite a lot of times. And there have also been times where I have gone to bed after a work day, probably on a Friday, and then I just wake up the next Sunday, as in not 2 days later, as in I would have gone through an entire week and then I would have just come back into consciousness and I would just not know what's going on. So, with that comes the second symptom, which is confusion, obviously, because you don't know what the heck happened while you were not there, you were not fronting. See, confusion is quite common because alters switch other alternative personalities inside your head, usually front. Sometimes it happens mid activity. And there are times when you're doing something or you're at a certain place and you have absolutely no clue what is going on or what you are doing at that particular time, right? For me, sometimes it's like if something has happened, if I was extremely stressed, there would be like a cleaning spree, or I would have hung out with friends I don't remember making plans with, right? And for example, me, I do not like mopping the floor or washing the dishes. And then one of my alters love doing all the housework. So imagine my situation where I would have probably switched and the other alter would have gone with cleaning up everything. And then I would just come back and I would just have this dirty plate that I'm holding in my hand and I have absolutely no clue why I'm doing it. And I would basically lose my shit. Happens a lot of times. Then we have another symptom, which is memory gaps. Again, another common one. Memory gaps is one of the most and the strongest indicators of dissociative disorders, because that's your brain's way of helping you cope with the trauma, right? So there are times where you would not have recollection of certain things. It can be events, it can be certain periods of time, it can even be people, or sometimes even personal information. Like all of a sudden, if you suddenly ask me my number someday, I just might not remember, because there might have been some experience, or there must have been some encounter which where I would have shared my number or some personal information would have actually brought out a negative outcome. So that's there. Not necessary that memory gaps only happen when you are facing a difficult situation, right? Memory gaps actually happen when another alternate personality is fronting at the moment. Like, for example, if one of my alters who are not me, right, were fronting and they met a bunch of people, or they were doing a particular activity, or they spoke to you, I would have no memory of it, because I was not the one who was there interacting or doing that particular thing. Right now, for example, um, I have photographic memory, almost photographic memory. I am able to remember who I've been with, the time, what you were saying, how many times you blinked, what you were wearing, things like that. But that is if I was the one who was interacting with you, right? So I'm like a paradox. So if it wasn't me interacting with you, and if it was another alter, it's not necessary that they would remember that particular detail, because they do not pay attention to such things, right? Now, um, if I was not the, like for example, if we hung out on some day and it wasn't me to someone else, and something happened that particular day, and then a few days later when it's me and you're talking to me about it, I have absolutely no clue what you're talking about. So all you're gonna get from me is my poker face. Happens. It's okay. Right. Um yeah. And then the next symptom is the exhibition of two or more distinct personalities. Right. Now, distinct personalities is what actually is one of the main indicators of DID. Dissociative identity disorder simply means that in your body you have more than two people. When you have specifically two distinctive personalities, that's what's called bipolarity, right? Polar opposites. And when you have more than two, uh, it's a system. So that's what causes the alters to present. Now, see, it's like having multiple people living inside your head, like a family. That's how a system gets created, right? There are people who have extremely different personalities, preferences, color choices, way of dressing, way of speaking. There would be things like there are alters who are of a different gender, different ages, different race, different sexuality, and there are also cases where alters, which are alter identities, right? Alters are not even human. We have shapeshifter alters, dead alters, ghost alters, animal alters. Yeah, all of that happens. But what usually happens is that all of these alters are basically uh, fragments, right, that got split up at a very young age after very traumatic experiences. But at the end of the day, when you combine all of them, they still become a whole person, right? And I will speak more about alters and everything else in another video, so that with the kind of roles and everything else that you will be having. But you see, that's what it is. And there are DID systems that have a lot of alters. We are aware of systems that have up to 75 different alters. We have systems that have 5 to 6 alters. And sometimes it's not necessary that you know how many alters you actually have. You would have specific alters that are quite prominent in your system that would be fronting, that take care of your daily tasks and everything else. And sometimes, because of a certain trigger or something like that, you might see different alters actually coming out later on. Right? So that's always there. Because of exhibition of 2 or more personalities, you would also have another symptom, which is out of character behavior. Well, obviously, that's what's going to happen, and there will be inconsistencies in behavior when there are more than 2 people inside your head, right? Usually, for example, if I take my case, I am right handed, but I do have alters in my system who are left handed. So, as much as I call myself ambidextrous, you would always see me doing things with my right hand predominantly. So, it's not surprising that sometimes when they front, you would actually see them doing something quite different as compared to what I would be doing. Classic example would be there have been times when I have been with my friends, probably eating or talking about something and everything else, and I would be eating with my right hand, writing something, writing a check for them, things like that, and automatically it just switches to my left if another alter comes in. Out of character behavior. Sometimes I am an extremely nice person, right? A people pleaser, extremely social, would help anybody and everybody that needs it. And then there would be other days where it might be another alter and I would just be that bitch. Well, another symptom that is there with dissociative disorders is obviously dissociation, which is the feeling of detachment. You feel detached completely from emotions, from a situation, from people, from a period of time. It's like you zone out, right? So, what usually happens is to help you cope with a difficult situation, your brain just disconnects you. And it feels that you are viewing an experience, something that's happening to you, from a third person's perspective. Dissociation also happens when another alter in the system is fronting. For example, if there are switches that happen, that's also when you would see the person dissociating, right? Now, dissociation is not something that's always quite evident, though if you do pay attention, you will be able to catch it. For example, the eyes, they change a little bit, right? You would see that we are zoned out. And but then sometimes the dissociation can be extremely painful physically, especially when there are alter switches. We would feel sleepy. We would be having a lot of headaches, right? Because like the brain just disconnects and there's just a lot of emotions that come in and everything else. When there is a personality switch that happens, something has triggered, so your brain is trying to numb it out, and then all of a sudden that numbing just stops and everything just comes back to you. So that happens a lot. But then sometimes dissociation happens within the blink of an eye. Sometimes your alters just present and you wouldn't even realize the switch. I mean, that's what DID does. It just masks itself so well so that another person is not able to understand that there are more than one people interacting with them, right? So, yeah, these are some of the common symptoms of DID. Although And these are the indicators that are usually used for the diagnosis as well. But then, the different people experience and present symptoms other than the ones that I have mentioned. But yeah, some of the ones that I've mentioned are the common indicators to know if you or someone you know has dissociative disorders. It's not necessary that it would be DID. It can also be either dissociative amnesia or depersonalization and derealization, right? So yes, that's the end of the video. Please do let me know if this helped. And if you have any specific topics that you would like me to cover, just let me know in the comments below and I will get to that as soon as I can, right? Oh, and don't forget to like the video, share it with someone whom you feel can benefit from it. What we are trying to do with this channel is just to educate people about what DID is, and that it doesn't really hinder a person at all, right? If you actually Google for the symptoms of DID, a lot of sites, medical sites, actually mention, unable to cope with stress, inability to function normally. Isn't true. I'm here. I live a regular life. I live a fairly normal life. It's just, I don't do that alone. That's all it is, right? And don't forget to subscribe to my channel. And I'll see you guys in the next video.